one of the things that we're assessing is students' mental health. And we're looking at whether our intervention that we've designed is actually impactful or effective at improving students' mental health. And one of the biomarkers that we're looking at, for example, is the activity levels. And there's been research which has shown a relationship between mental health and activity levels, such as like with people who experience symptoms of depression having lower levels of physical activity compared to people who don't have symptoms of depression.
In the case of Shamiri's previous studies, we've always used self-reported measures. Self-reported measures, they're not necessarily telling us accurately what's going on. They're subject to a number of biases. For example, if the student just tells us, oh, I feel good, I feel, fine, but really they're not feeling fine. In the case of biomarkers, that will tell us that they're not really fine, and this is actually just more accurate. So that's why we wanted to use biomarkers in this study to give us more accurate information instead of the student can tell us something that's not really how they're actually feeling.
Some of the metrics that we track include sleep tracking, personal activity intelligence, that is PAI, and also monitoring the heart rate.
In terms of how reliable this data would be, I would say it would have probably more than 60% reliability, and this would inference some credible data and statistics on our side.
So if we're able to make our analysis and get the heart rate variability, we'll be able to understand or get some indication of the potential risks to mental health like anxiety and depression. So I would say it's it's proving to be quite effective so far.
We are going to get data that is at least, we can say, like accurate, because it's for a span of 2 weeks. And it's from the wearables are in contact with the skin of this person. Sometimes like when you're taking the blood pressure, a participant may just come, and because she was in a hurry running, the blood pressure levels we might get a wrong indicator of that blood pressure. But when it comes to this wearable, because this participant has stayed with this wearable for 2 weeks, then we are sure that the data that we have extracted from that wearable, it's the accurate one.
Yes, I see my future improving because of this exercise. Simply like through this exercise, I've been able to know how to deal with situations like when I'm stressed.
The wearable has helped me a lot since I've known the footsteps that I take, and sometimes I've known the calories that I cut for a day. Sometimes when I'm stressed, when I see at the wearable, I see the stress and I'm just like, I relax.